screen.
All right, moving on here, the pandemic has had a major impact on people's mental health, especially with the back and forth shifts between safety guidance. It can cause a lot of stress. We know that. Joining us now is Dr. Laura Saunders from Hartford Healthcare. Dr. Saunders, thanks for joining us. We know this pandemic isn't going away. In many ways, it feels like we're right back where we were in 2020, emotionally at least. We know it's depressing. What's your advice when it comes to changing one's mindset if they are feeling hopeless or depressed right now? It's understandable.
Thank you, Ben, and Happy New Year to you. I think that it's really important that we identify sort of how people are feeling. And I think two prevailing emotions are fatigue and frustration, right? So there's a level of fatigue. This has been going on for an extended period of time now. We're going on 2 years. And, you know, as adults, we have a better ability to have perspective. I worry a lot about young people. In terms of frustration, when people really have high levels of frustration, they're less likely to follow guidelines and protocols, and that's worrisome. So let's identify what's going on. There's a lot of frustration and a lot of fatigue.
So I want to talk to you about that frustration, because some of that frustration, as you mentioned, comes from the guidelines. The guidelines are constantly changing, whether it be from the CDC, from the government, local, state, on the federal level. Following those rules can be frustrating, especially when you want to follow the rules to keep you safe, to do the right thing, to keep people around you safe. What do people do with that frustration, and what's the best way to deal with it if you're feeling it at home?
So I guess the reframe that I want to take on that, Ben, is that the guidelines are evolving. They feel like they're changing, but they're evolving. I mean, science evolves. And as we get more information, as more research is done, it's evolving. It feels for a lot of people that it's changing in a way that doesn't make sense. But I guess what we'd like to believe in the medical and scientific community is that it's evolving. So the best thing to do is follow the guidelines as they present themselves, because that's the best thing to do for ourselves and for our families. There's a lot of uncertainty, and I think what people, continually are saying is, when will this end? And that, when we don't have an answer to that, it engenders a sense of hopelessness, which becomes very difficult to manage. So the best thing to do is identify what's going on, find small things that bring you joy, and reach out if you need help.
One last question here. Let's talk about our kids. They're going into schools wearing masks. Some of them are learning remotely. Maybe they're on a hybrid schedule. Maybe they're at home completely. What should be the main focus when talking with our kids about what we should look out for when it comes to signs that our kids might be struggling? If you're 5, 6 years old, maybe you don't know how to vocalize that you're hopeless or frustrated. But as a parent, what should we look out for if they can't say it themselves?
So I'm worried about the kids of all age ranges. Yes, 5 and 6 year olds, but they're a little bit more sheltered. Parents really kind of set the routine and set the structure and hopefully contain their own anxiety to not put it onto their kids. I'm really worried about middle school and high school age kids, because they're really feeling the effects of isolation and quarantines. And I'm particularly worried about teachers. Our teachers and our healthcare workers are really in the front lines of so much of this, doing the absolute best that they can to provide an education. But it's a lot of the frontline folks, our teachers and our healthcare workers, that I'm most concerned about. For our kids, identify how they're feeling, support them, but there's not a lot we can do, because there are things that they're missing, and there's a lot that's going on that's not in any of our control.
The pandemic affects our physical health, but definitely our emotional health as well. We appreciate your time as always, Dr. Saunders. Thanks.
Take care, Ben.